Thank you for joining us today. And I'm glad to be joined by General Matt Quinn, the Executive Director of our COVID-19 Task Force. Today we wanted to give you a brief update on Montana's response to the COVID-19 pandemic, specifically our vaccine administration efforts. Improving Montana's response to this pandemic has been my top priority as your governor. It's why on my second day in office we adjusted the state vaccine distribution plan to prioritize and protect the most vulnerable. Montana was on the cutting edge of this new approach. A week later, the federal government followed suit and issued similar guidance. Prioritizing Montanans who are most vulnerable to serious complications or death from COVID-19 is just common sense. We prioritize Montanans 70 years old and older, and Montana's 16 years of age and older with severe underlying health conditions like cancer, heart disease, and Native Americans and other persons of color. When we initially launched Phase 1B on January 19th, the eligible population accounted for 75% of the deaths and 50% of hospitalizations from COVID-19 in Montana. Keeping our focus squarely on protecting the most vulnerable, we went a step further last Monday when we expanded the state's vaccine distribution plan to Phase 1B+. We ensured Montanans 60 years of age and older and those at elevated risk of complications or death from COVID-19, including asthma, cystic fibrosis, could get a vaccine. The Phase 1B+ population accounts for nearly 90% of Montana's total deaths and more than 70% of Montana's hospitalizations from COVID-19. We took a strictly data-driven approach to protect the most vulnerable, and we're saving lives. We owe our healthcare workers and volunteers a debt of gratitude for their work over the last 3 months to administer these safe and effective vaccines. As of today, Montana has administered over 367,000 vaccine doses, and more than 140,000 Montanans have been fully immunized against the virus. There are healthcare workers who have been at the front lines of this pandemic for the last 12 months. There are older Montanans who live in long-term care facilities and the staff that support them. There are seniors who are at risk from this virus. There are friends, neighbors, and family members who are battling for their lives against cancer and other serious conditions. Our approach is working. Hospitalizations remain low, with 54 today in the entire state. 42 counties have cases in the single digits. Of those, 15 counties have no cases at all as of today, and only 3 counties have more than 100 cases, all under 130. There are also only 878 active cases in Montana today. The last time Montana had less than 900 active cases was July 13th. And as vaccine production ramps up and new vaccines are introduced, we're seeing greater supply, and our hope is growing stronger. For the first time in a long time, the most vulnerable among us feel they can return to a sense of normalcy. And slowly but surely, we are all returning to normalcy. Before we can fully return to normal, however, it's critical that COVID-19 vaccines are available to every Montanan who wants one. And making the vaccine available to anyone who wants one and encouraging Montanans to get the vaccine have guided us in our approach. Some counties, which began vaccinating their Phase 1B+ population as soon as they were able, have indicated they will be ready to move to the next phase soon. This number will continue to grow. A few months ago, projections estimated Montanans 16 years of age and older would be eligible for vaccine as late as mid-July. Today, I'm pleased to announce that we're moving up that timeline. All Montanans 16 and older will be eligible for COVID-19 vaccine on April 1st. Over the next 15 days, DPHHS will continue its routine surveys to help where jurisdictions are in their Phase 1B, to see where jurisdictions are in their Phase 1B plus population and see how the state can support them. And on Thursday, April 1st, we will make these safe, effective vaccines available to every Montanan who wants one. To handle this expansion, we're looking at how to continue working with our pharmacy partners so they can tap more into the state supply and get vaccines in arms. I've said for some time that when my name comes up in the line, I'm going to get my vaccine. Well, my name, like all other Montanans, 16 and older, is coming up pretty soon. I look forward to getting the vaccine when my name is called, and I encourage all Montanans to consider doing the same. Getting one of these safe, effective vaccines will protect you, will protect your loved ones, and your neighbors from this virus. It will help us get back to a more normal life, and one where we get together with friends and families without worry, where we can shop and go to restaurants without worry, where we can go back to our places of worship without worry, where we can go to our kids' baseball, football, and volleyball games without worry, and all without masks. As more Montanans get the vaccine, we will continue to approach the time when we're no longer in a state of emergency and we can remove our masks and throw them in the trash can. And with that, I'm happy to take some questions. Zach, you want to go first?
Yes, Governor Zach Kaplan, Montana right now. I understand that you were on a call this morning with the National Governors Association as well as White House staff. And I'm just wondering, after the president's announcement late last week, just the overall thought process going forward with the president's plan to have vaccines available to all adults by the end of May.
Yeah, well, we're making better progress here in Montana. On the call earlier today with the White House, we were encouraged by the production levels coming from the pharmaceuticals. This week, nationwide, we'll receive about 16 million doses. In the first week of April, that supply will increase to about 22 million doses per week. So we have greater supply. That's why we're expanding distribution and making the vaccine available to all Montanans, beating the national deadline and doing it April 1st.
And just to follow up on that, with the president's announcement, do you feel at all like he is putting undue pressure on governors like yourself to meet that deadline, or do you think that's a fair deadline to set?
Well, the federal government's been following our lead for some time. It started with our change in vaccine distribution plan, focusing on the most vulnerable. We've seen great results here in Montana with slowed infections, less hospitalizations. And here again, because we've been so effective in getting vaccines in arms, we're able to actually accelerate the date with which we're making vaccines available to everyone. Jonathan?
Thank you, Governor. Jonathan Amberry in Montana Television Network. I wanted to ask, what was the reasoning for, or rather I should ask, is there likely before April 1st to be an opening of the Phase 1C as we had before with some particular occupations, teachers involved for one thing? And if not, is there a reason why we decided to move forward to all Montanans rather than starting 1C, that group we had set aside before?
Yeah. Jonathan, from the beginning, we've really focused on the most vulnerable. And with the movement to 1B+, we've now addressed the population where we've seen over 90% of the deaths and hospitalizations. And the next logical step was really to make it available to everyone so that we can go back to normal. Can we have a call online?
Hi, Governor Gianforte. This is Rachel Kramer with Yellowstone Public Radio.
Hi, Rachel.
I'm curious because, so Montana is expected to receive about 20,000 vaccines, or it's been allocated that for this week. How long are you estimating it will take to vaccinate every Montanan who wants one? And how much will Montana's allocation increase in coming weeks to be able to meet these faster timelines?
General Quinn, could you address that?
Yeah, thanks for the question. You know, obviously, as it has been since we started, it depends on the vaccine supply. So we did see an extra case of Pfizer coming in for next week, and we would expect for those to continue to increase. So I would estimate at least by mid-May, probably end of May, Montanans that want the vaccine will have the vaccine in their arms. And that'll continue as vaccines continue to go up, the vaccine supply.
Holly, do you have a question?
Yeah, I had two questions. I don't know if these are best for you or Quinn. I'm wondering about the uptake rate for the vaccine, and I know that varies by populations and different types, and I'm kind of wondering generally what that's been across the state for people eligible so far. And then wondering, too, if we've had any other variant cases confirmed.
Okay, and I'll let General Quinn address the second half of that. First, let me just say these vaccines are proving to be safe and effective. Folks are getting more and more comfortable with this, and I encourage people when their name comes up to get the vaccine just like I'm going to do. General Quinn?
Holly, tell me that I didn't hear all of the second part.
So uptake rate and then variants. And I guess with uptake rate, too, I'm kind of curious, as you look at it in terms of moving toward the idea of herd immunity, if you're looking at uptake rate and percentage of Montanans vaccinated, and how you look at Montanans who have had COVID, but it might have been long enough ago, they're kind of outside of that window of assumed immunity still.
So I think in terms of Governor's response on the uptake rate is right on. You know, we saw good uptake, actually excellent uptake rate from the long-term care assisted living facility, residents and staff. Governor visited one of the assisted living facilities this morning with great uptake rate and frankly a great visit. The ones, so I think CDC is still looking at those who have had COVID and the vaccination and that timeline. I don't think that's clear yet. At least I haven't seen that that's been set in stone yet. Now, and again, tell me the follow-on. Sorry.
About variant cases, I know
Yeah,
there's some.
no additional from the report last week. So we had 5 last week. We haven't seen any more. All of those 5 were the UK variant and down in the Gallatin Valley. Nothing further.
Okay, we'll take another question online.
Hi, Governor. This is Mara Silvers with Montana Free Press. I was wondering, I know you touched on it a little bit, but could you explain more about what kind of support the state is going to be giving to local county health officials and teams who are working to vaccinate such a high increase of people in the coming weeks? What kind of support, either infrastructurally or data sharing, might be available at a local level?
Okay. General Quinn, do you mind addressing, including the expansion to the pharmacies?
That's right. Yeah, so the State Department of Public Health and Human Services continue to work with counties and encourage them to expand the locations at which individuals can get the vaccine. Right now, 57 additional locations are receiving the vaccine. They've received about 40,000 doses of the vaccine, and so we continue to expand that. Again, one of the limiting factors is the vaccines coming into the state and how many we can distribute. But there's in total about 400 partners that we're looking to expand vaccine availability to across the state of Montana who have indicated a willingness to help get shots in arms of Montanans. So as soon as vaccine quantity gets to the state, we'll keep turning those providers on.
And I would just add, for folks looking to get a vaccine, the best place to go is the website of their local public health office. That's the place to check. And I understand that will include local pharmacies that have the information as our pharmacy partners make vaccines available. So broadening the distribution so people could have a convenient place to go in their local community. Is there another online question?
Hi, Governor Gianforte. This is Keith Schubert from the Daily Montanan. I was wondering if you knew what % of Montanans 65 plus are currently fully vaccinated, and logistically, do you need a Montana state ID to receive the vaccination on April 1st?
I don't think we need a Montana.
Yeah, I'm hearing from General Quinn that Montana ID is not required. I mean, we're trying to do the right thing by folks. Statewide, our fully vaccinated now is about 16%. That percentage would be higher amongst people 65 years and older because they're in the qualified group. So we're getting to the most vulnerable. Is there a question here in the room from anybody? Holly, you have a follow-on?
One thing I'm curious about, and this came up in one of the subcommittees dealing with the COVID money coming to Montana, there was discussion that some people looking at tourism options in Montana might be a little leery if there's not precautions in place like mask mandates or that sort of thing. I'm wondering, as you're looking at recovery and tourism in Montana, sort of what the thought of keeping people safe and comfortable about coming to the state, what kind of role that plays in those discussions?
Yeah, it's important that businesses continue to take reasonable precautions. That's why we did what we did. But I trust Montanan with their health and that of their loved ones. I was just up in Big Sky over the weekend. I have to say things were booming. And talking to some of the folks there, I want to be clear for anybody listening, Montana's open for business. We want folks to come. We're going to take reasonable precautions to protect our loved ones and our neighbors and our visitors. But let's start getting back to normal. This vaccine is going to make that possible for us. So do we have another question online?
Hi, this is Rachel Kramer again with Yellowstone Public Radio. I was curious if you have any update on how many counties have finished with Phase 1B+, and if a county or tribal government is finished with Phase 1B+, are they able to just immediately move into the stage that the state is moving into with April 1st, or would they go into Phase C? What would that look like?
General Quinn?
Yeah, thanks. We don't have an update. You know, we just started 1B+ last week, and so we're querying counties this week as to how they're progressing through 1B+, and we'll continue to query them. What we encourage counties to do is, if they believe that they're done with 1B+, and this is true for tribal governments as well, reach out either through Indian Health Service or the state, and let's work together on what the next best step is. But for the state, we will move into the next phase on 1 April, and that's, as the governor said, all Montanans would be eligible.
Yeah, Jonathan, a follow-on?
Thank you, Governor Jonathan Amberian. Again, I wanted to ask if you had had a chance to see the DPHHS report that came out today on the number of excess deaths that the state saw, I think something along the lines of 2,000 last year, and particularly breaking down COVID-related deaths and also suicides, alcohol-related deaths, and some of the other categories like that. I was curious if you'd had a chance to see it, and if so, if you had a reaction to it.
Yeah, so Jonathan, I haven't had it, I know of the report, I haven't had a chance to review it just yet. Do you have a particular comment on that or not?
No particular comment.
Okay. Yep.
Thank you.
Is there another online question?
Hi, Mara Silvers again from Montana Free Press. I was wondering if any of the expansion of vaccinations is possible or is more possible because of the new stimulus money that Montana is expected to receive. How is that factoring into this decision, if at all?
Yeah, they're really unrelated. Our plans currently are just continuing to execute under the prior CARES Act. So we're still absorbing this new stimulus bill and still making plans. None of that money's been appropriated at this point by the legislature. Holly, you had another question?
Yeah, a similar question on the stimulus money and that's coming to Montana. There's a provision in that says that states can't use that money to directly or indirectly offset tax reductions and that you can't have any net reduction in tax revenue. I'm wondering if you looked at that in terms of some of the things in your proposals for what you'd like to do with tax cuts here in Montana, and if there's any concern that there might be conflict there with some of the strings tied to the ARPA money.
Yeah, so we're still trying to get clarity on this. This is one of the problems, that things are moving quickly in Washington and here in the state. Our plans for tax reduction were based on the existing budget and not directly or indirectly related to the new money coming in. That being said, we want to be extra careful that they don't get conjoined, and we're looking at that, and we're going to take the necessary steps there. Yes, Holly?
one more back to COVID stuff. I've seen reporting very few number instances of this happening, but I'm wondering if it's something Montanans tracking. People have been vaccinated and then later do get COVID. Is that something that the state's watching at all, and have we had any?
Yeah, we don't have any information for you on that today. Are there any other questions in the room? You have one online? Okay.
Hi, Governor Gianforte, Rachel Kramer again with Yellowstone Public
Hi,
Radio.
Rachel.
I wanted to return back to one of something that came up earlier about the UK variant showing up in Gallatin Valley. So were those 5 cases new cases in addition to the 3 that happened the first week of March, or was that 5 including the first?
Okay, I'm going to let General Quinn address that.
Okay.
Yeah, Rachel, thanks. So it was the 3 original and then the 2 additional that I reported out last week. So 5 total, not 8.
Okay. Looks like we have one more question online here.
Hi, Mara Silvers again. I was wondering could you just give us a kind of an overall summary of what the state's plan is or efforts look like for informing the public more about the safety of the vaccines and trying to increase that uptake rate even more? Is there something that's changing in that effort in the coming weeks, or are you going to continue to be doing much of what the state has been doing?
Yeah, so thank you for the question. It's important that we get the message out that these vaccines are safe and effective. That's why I always talk about when my name comes up, I'm going to be in line getting it. In addition, DPHHS is planning some public service announcements related to the vaccine, both on radio and TV, to encourage people to get vaccinated, because that's going to give us a brighter future. So I want to thank you all for being here today. And with that, we'll wrap up our press session. Thank you.